What a lot of women don't realise is that when you push a baby out, so if you're planning on having a vaginal delivery, you push a baby out, your pelvic floor has to stretch 2 to 3 times its size, 2 to 3 times its resting length to get the baby out, right?
If you had to give someone an elevator pitch on like a women's health physio, how would you kind of describe it to your everyday person?
So I would say a women's health physio looks after...
In today's episode, we sat down and spoke with Charlotte Conlon. Charlotte is known really well online as Miss Pelvic Health, and she's a women health physio who's also the founder of Flow Women, working within the Sutherland Shire at Flow Physio Co. Throughout the episode, we spoke about a number of different things, some of which included what a women's health physio actually is, what a women's health physio consult looks like, but more importantly, where you might find some use in this episode is unpacking a little bit about what the pelvic floor is and what some of the typical symptoms that you might be experiencing are. Before we dive into this episode, if you are experiencing any issues, please make sure you go and see a women's health physio and unpack them with them face to face, as we are hoping for this just to be a generalised discussion.
Before we dive in, this episode is brought to you today by Soma Cacao, our go-to for an afternoon pick-me-up that actually does something. Did you know that ceremonial cacao is the richest natural source of magnesium by weight? Because of this, Soma Cacao helps to support nervous system regulation, muscle recovery, and even stress reduction. Use the code WDKY10, that's WDKY10 for 10% off your first order. We'll pop it in the show notes. A huge thanks again to our friends at Soma, and let's dive into today's episode.
Welcome back, everyone. Welcome, Charlotte, to the We Don't Know Yet podcast. We're super excited to have you in. This is well overdue.
I know. We were all saying that off air, weren't we?
Very
it's like time
well
goes
overdue.
way too fast.
Yeah, but we've been really excited to get you in here. What do you think of the studio?
It's amazing.
Yeah.
Thanks for having me.
No.
So excited for this chat.
Yeah, very, very good. And, I guess we, at the start of today, did intro you a little bit more to our guests, but, I guess how did you get into the pelvic health space or pelvic health physiotherapy space?
Yeah, so I was always such a sporty kid. Like I grew up in Caringbah with an older brother and just loved sport. Like I played hockey, surfing, snowboarding, Oztag, and I just always wanted my career to be involved in sport. Mm-hmm. So I ended up getting into physio, and I always envisioned me being like the physio for a sports team. Yeah. Like the NRL or something like that.
I feel like that's such a common, allied health pathway.
100%. And I always just was like, no, that's what I want to do. And then I was a sports physio for about a year, and it just wasn't my passion. Mm. And then I just randomly fell into doing some kind of Pilates and women's health style physio, and then I just loved it. And I was hooked after that. Yeah. So I completely turned my career around, and now all I do is women's health physio.
That's great. I was thinking as well, like it speaks so nicely to someone when they are so early on in their career, just being open for whatever comes your way and just giving it a crack. And if you like it, awesome. If you don't, just finding something else.
Yeah, exactly. Like teenager me would never have thought that I was going to be doing women's health physio. Like it wouldn't have even crossed my mind. But now it's no turning back.
Amazing.
And so the Pilates stuff, was it an interest for you personally? Like were you kind of like doing some of that yourself?
Yeah, like I always have been someone that exercises, goes to the gym. I started doing Pilates and then really liked it and did some Pilates training, which a lot of women, like a lot of physios do. Yeah. And then, just loved it. And naturally pregnant people started coming to Pilates and postnatal women. And then I just had a real interest in like treating them. And that's how it kind of came about.
And here we are.
Yeah.
And how many years has it been now?
I graduated from Sydney Uni in 2013. Yep. So, yes, getting on now. So I did that first year after uni with like in sports physio, in rehab, and then I changed straight over.
Yeah, awesome.
So over a decade.
Wow,
Time's
awesome.
So fast. You don't look old for what it's worth. It's just time's going very quickly.
And we were talking a little bit off air. You've beat the 5-year burnout kind of landscape where like a lot of physios, or osteos or chiros tend to kind of drop out. Do you think your passion for this space has really kind of kept you
100%.
In the profession?
Yeah, I always would say like I don't think I still would have been in the profession if I didn't find women's health.
Yeah.
But then I found the passion for it and I just love my job so much. So I'm very lucky that I get to keep doing it.
And you do have such a strong online presence as well. So when you, I guess, first delved into the pelvic health space, is that when you created Miss Pelvic Health?
I created it a few years later.
Okay.
So, yeah, there wasn't too much on social media at the time to do with women's health. So I really just wanted to start to educate women. And it was really after COVID that I started it, because women weren't coming into the clinic as much. Yeah. So I wanted them to still be able to get education on birth prep and postnatal. And then it just grew from there.
Yeah, awesome. I'm not pregnant, nor I haven't been pregnant, sorry. My words aren't wording. But my friends and colleagues who have been pregnant or, pre or postnatal speak so much to how, having a strong or a good pelvic floor, does make such a difference.
Yeah, well, I think as well, it's like we were talking a little bit about before, it's not something that's still very well known. Like a lot of people do know about it now, but like if you had to give someone an elevator pitch on like a women's health physio, how would you kind of describe it to your everyday person?
So I would say a women's health physio looks after everything to do with the pelvis, the pelvic floor, the abdomen. Mm-hmm. We do women of all ages. So I might see teenage women that are experiencing pelvic pain, period pain. I'll see women that are trying to conceive and want to get an idea of where their pelvic floor is at. Mm-hmm. Then we would see women through their pregnancy, postpartum journey, and then everything in between. So when women start to go through kind of that perimenopausal phase, a lot of pelvic floor issues start to come to light. So I see predominantly after kind of postpartum, lots of menopausal women. Yep. It's just so important in every aspect of women's lives.
Yeah, absolutely. And likewise, we were talking about the fact that I think now that the women's health landscape is coming a little bit to light, like have you noticed that there's and this is just me purely being curious here, like a men's health like landscape developing?
There definitely is. Yeah. I'm not a men's health physio, but it is very much needed. Yeah. There's so many men that need pelvic floor physios, and there's so many fantastic men's health physios out there. Yeah. You should definitely get on the podcast.
Yeah, because I started like looking, like obviously once we started to look into this topic in this discussion with you today, I was like, damn, like I've got a pelvic floor.
Yeah. Really?
Like, yeah, I know, but it's not something you kind of think about, I suppose. And then like I was like, if I had a problem, where would I go? Because for, like you said, education in information reasons, the women's health landscape is like really big at the minute. It's really growing, and especially in the physio landscape. But yeah, I was like, I don't really know where I would even look for information, or if I would just go to a women's health physio. And
there's generally like women's health physios that do men's health as well. So like a pelvic health physio. Yeah, cool. They do both. And then some women just do women's health.
Okay, great.
I'm busy enough with the women.
I was about to say, yeah. It's good to like zone in there.
But it's very much needed.
Absolutely.
Yeah. And I think with social media, the women's health space is coming a long way, and I think the men's health needs to catch up a little bit.
Yeah. And even from like a completely different angle, going a little bit not off topic, but a bit of a tangent here, like in the dietetic space, I've had so many clients with like IBS-y like symptoms, and you do everything that you possibly can from a dietary perspective. I've sent a fair few to like pelvic floor physios, and it ends up being like an overactive or an underactive pelvic floor rather. Yeah.
With the pelvic floor, a lot of people don't know that it can be one of the causes of constipation. Yeah. So the pelvic floor has to kind of wrap around the rectum, and it has to work properly for you to be able to go to the toilet. Yeah. So people change their diet and they do everything, and they're still having defecation issues, and it could be the pelvic floor. So that could be women, could be men. Yeah. Could be the missing link for some people. Yeah.
And so I suppose before we go too deep into signs, symptoms,
that was me just like
like what do we define as like the pelvic floor for someone who's kind of like a little bit unsure about or doesn't have an anatomical understanding?
I don't know what a pelvic floor is.
I was about to say we can really dive into it. I might get some images to overlay over the top as well, but like what do we actually look at when we're talking about pelvic floor?
So essentially the pelvic floor is the base of our whole pelvis. So you've got superficial muscles and you've got deep muscles. Mm-hmm. And essentially these muscles wrap around the pelvic organ. So they wrap around the bladder, the uterus for a female, and the rectum. Mm-hmm. And the main job of the pelvic floor is to hold up these organs into the pelvis to stop you leaking from the bladder and the bowel, so they control continence. They play a really big role in sexual function. And the pelvic floor also has to relax really well for you to be able to empty your bladder and empty your bowel. So the pelvic floor is just that whole space on the bottom of the pelvis.
Yeah. And in terms of relationships with the rest of the body, then you mentioned abdomen as well as an area that you kind of look into as well when treating women or when managing women.
Yeah.
What's the relationship a little bit there for someone who might not know as well?
So the pelvic floor is the base of the whole core canister. So if you think of the core canister, the pelvic floor is the base. The diaphragm, which is our breathing muscle, is the kind of lid to the canister.
Yep.
And then you've got your core muscles which wrap around. So these all have to be working optimally together to have a functioning core canister. So yeah, we look at all of those aspects. We look at how women breathe, how they turn on their core, if they're too grippy through their core, if they're underactive through their core. Same with muscles of the pelvis, like the glutes, the adductors, all of that.
Yeah.
So they all have a really close relationship.
Yeah, strong kind of tie. And I like how you talk about it as a canister. I feel like anytime people think of abdomen, they're like the six-pack muscles or the no six-pack muscles. But you're right, like it really does wrap around, from the side all the way through to the front. In terms of like, I suppose where you frequently will see someone or someone comes in to see you at the clinic, what are the typical reasons that people will actually present to see you?
So if someone's pregnant, ideally, we want them to come in even if they have no symptoms.
Yeah.
We want them to come in for a pelvic floor screening so we can make sure that, one, they're contracting their pelvic floor correctly. Because we know from research that about 20 to 30% of women actually bear down when they squeeze their pelvic floor instead of drawing up, which you can imagine if they're doing that their whole pregnancy, they're just going to be putting strain on all of the tissues and the muscles. So we want to make sure that they're doing it correctly. Mm-hmm. And then we want to see if their pelvic floor is functioning properly. So we want them to be able to squeeze, let go, because what a lot of women don't realise is that when you push a baby out, so if you're planning on having a vaginal delivery, you push a baby out, your pelvic floor has to stretch 2 to 3 times its size, 2 to 3 times its resting length to get the baby out, right? So to put that into perspective, the hamstring would tear at like 1.2 times its resting length.
Right.
So we want to make sure that they can lengthen it, they know how to push correctly.
Yeah.
So that they can have better birth outcomes.
Yeah. And avoid the risk of tearing and other complications.
Yeah, exactly. Yeah. So from a pregnancy point of view, we want them to have no symptoms coming in so that we can check everything and try and optimize their outcomes. But even more so if they're having symptoms. So if you're experiencing any urinary incontinence during the pregnancy, we want you to come in because we know that if you experience that in pregnancy, you have a higher risk for experiencing that postpartum.
Yeah.
And then postnatally, same thing. Most women feel okay at 6 weeks, but then we do a pelvic floor assessment, we do a core assessment, and there's so much that they need to work on. So in those two kind of groups of people, they don't necessarily have to be having any issues. Yeah. But with the general population, some common pelvic floor issues would be urinary incontinence. So that is if you leak with a laugh, a cough, a sneeze, but also if you leak with an urge. So some people leak on the way to the bathroom and they can't quite hold it because their bladder's going into spasm. Yeah. Women with prolapse symptoms. So that's a dragging feeling in the vagina, a heaviness. Yeah. Women with pelvic pain, symptoms with like endometriosis, constipation, things like that. Yeah.
Yeah, a
Big
whole
list.
a whole list of
so
symptoms.
many different rabbit holes.
Yeah, and do you think we're moving? So we've had a conversation going over the last how many episodes now about the push for like preventative healthcare and how there needs to be like
not just putting fires out.
Yeah, not putting fires out, not waiting to the last second to go in and see a healthcare practitioner on the premise that you think there's not a lot going on. Yeah. Do you think there's really good validity even for your general pop patients like you were talking about before that might not be pregnant but like before they start experiencing symptoms? Do you think there's good validity to get in and just see someone even just for a quick screen or a quick checkup or a hi, my name is?
Yeah, absolutely. I think we're in such a good position to be able to prevent birth injuries and optimize birth outcomes.
Mm.
So I love it when I sit down and I say, what have you come in for, to my patient? They say, well, I'm not pregnant yet, but I just want to see what my pelvic floor is like.
Cool.
And that's awesome because we have so much time.
Yeah.
We can figure out, okay, we need to be doing this before you're even pregnant. Whereas someone comes in, we can always be working on things, but then we're against the clock. There's a little bit less time. So yeah, that's the ideal scenario.
Yeah. The what is it? The best news to get from the patient is that nothing's wrong. They just want to sit in and have a chat with you and find a little bit more out about whatever it is that you're kind of specialising in.
I think it's also extra nice in those situations because they're obviously so motivated. It's not like they're just coming in because they want the issue fixed then and now. Then and there, rather,
Yeah, absolutely. Fantastic. In terms of assessment and stuff like that, obviously people might be a little bit nervous to get in because we're talking things like pelvic floor and vaginas and rectums, and people are a little bit like, oh, that's a lot for my like Tuesday morning appointment with the physio. What does a typical kind of consult look like with you guys?
So generally our consults would be an hour because we really want to unpack someone's subjective history, much like you guys would do. And then we want to get a really good assessment of the pelvic floor. Now, the gold standard assessment is to do an internal vaginal exam because I'm going to be able to feel the tone of the muscle. I'm going to be able to feel how strong it is, how well they can coordinate it. But obviously, for some people, that might take a little bit longer for them to be comfortable with. So if someone doesn't want an internal vaginal exam, I can also do an ultrasound on the pelvic floor. And I can do that on the abdomen, or I can do that on the perineum, which is the space between the vagina and the anus, which I can see really well the pelvic floor. And it can give me some information. I'm going to be able to tell if they're doing it correctly, but it's just not going to give me the full picture of everything that's going on. So most of the time I explain why it's so important and so needed, and most people are pretty comfortable with letting me do it. But obviously it's going to be their choice.
Yeah, absolutely. And a super safe space as well for a lot of that stuff usually as well. Did you know I've actually had a pelvic floor ultrasound before? Just fun fact for you guys. Yeah, super wild. Yeah,
I'm
crazy.
interested.
So I was working with a physio colleague of mine who she is a women's health physio as well. But she was like, I've never actually like tested it out on a male, and just for the good of science, we were like, let's just give it a crack. And I was like, it gives you really good like feedback. I can see how as a patient as well, trying to get an understanding for what's going on, actually being able to visualize it and being like, okay, that's me contracting my pelvic floor.
Could you do it?
Properly? Yeah, I could by the end of it. But it was that whole learning experience of like, okay, no, I'm not doing it right. And then after a little bit of coaching and some tips, like you change it and you can actually see it change a little bit on the ultrasound as well.
Is it the same for men as it is women, like that, like holding and squeezing?
They say for men, nuts to guts is
nice. That is cool. We're going to catchphrase.
Nuts to guts.
Yeah. I'm not sure if it's copyright anyway, but we're going to catchphrase that. That's awesome.
Like
we might get that on a t-shirt, like for our men's health episode when we get a men's health expert in.
Because like for a woman, I might use lots of different cues. Like you might say like squeeze vagina, squeeze anus, like you're stopping wind, stopping wee, lifting it up. I might say one that works really well for some of my patients is imagine that you have a diamond, or the most expensive diamond, inside your vagina and your rectum, and you don't want to let it fall out. You're lifting it up,
surely there's a period of laughing that has to subside before you can actually finish the assessment in those scenarios.
It's funny because some people, like you can say all these cues, you can rattle them off, and it won't be until there's just this random cue that they're like, oh. And then they do it, and it's like, okay, that's your cue then. We're going to use that one.
Yeah. So do you use the ultrasound as a way like to get feedback for patients as well, or not really?
Definitely. I do. It can really depend though. So if I'm doing like an ultrasound on the abdomen to look at the pelvic floor, it really looks at the bladder and the pelvic floor, lifting the bladder up. But for some women, you might not see anything happen, and that doesn't necessarily mean that they are not doing their pelvic floor. So if you think about like my bicep, if my bicep was really tight and you asked me to do a pelvic floor or a bicep contraction, I'd be like, it's already on. So if I'm ultrasounding that, I'm not like, you're so weak, you can't do it. It might be that you're already at your end of range and we have to try and teach you how to relax it.
Right.
Or
right.
it might mean that it's not moving at all and it's super weak. So we might not be able to tell just from ultrasound because we can't just guess.
Yeah.
Whereas from me doing an internal exam, I'm going to be like, oh, okay, no, actually you're really high tone.
Yeah.
That's why it's not moving on the ultrasound.
Yeah.
So it can be a really good tool, but it does have its limitations.
Yeah. And I guess that segues nicely. And look, I'm sure there's a lot of nuances to it, but as a general, I guess, overview, what is the difference between like, pelvic floor tightness or pelvic floor weakness?
Yeah, so pelvic floor, ideally you want it to be long and strong. Like you want it to be able to squeeze really well, be strong, but also be able to relax and let go.
Yeah.
So that's the ideal pelvic floor. If someone has low tone, weakness, poor endurance, they may be suffering from things like stress incontinence, fecal incontinence, prolapse. If the pelvic floor is tight, it doesn't mean that it's strong, right? It can be tight and weak. So someone with a tight pelvic floor doesn't necessarily mean we just need to relax it. We may need to down train it with the hope to then up train it, if that makes sense. But some common symptoms for an overactive or a tight pelvic floor are pain with sex, pain with like women using tampons or menstrual cups, chronic period pain, back pain, hip pain, which is often really missed with some physios because hip pain, back pain can be really linked to a tight pelvic floor. Yeah. So it's so important. Again, that's why we need to check. We need to see, is it weak? Is it tight? Is it a combo of both?
And with the tightness, can things like, I guess, mental health or stress or even like, as you said, endometriosis and that, period pain, can it exacerbate that tightness, I guess?
Absolutely. Yeah. So if you're a stressed and anxious person, you might be tense everywhere, right? You might hold tension in your muscle. Pelvic floor is a skeletal muscle, so it's kind of no different.
Yeah.
Women with endometriosis, if you think about it, they're in chronic pain most of their life. Yeah. So the pelvic floor can respond to that and it can tense and grip in a response to being in pain, kind of like if someone had a back injury, their back muscles can tense and spasm and then that can just create more pain. Yeah. So often we need to try and work and relax the pelvic floor in order to reduce their pain. Yeah. Similar to other physio and other kind of conditions.
You can see how it'd be such a vicious cycle because the pain's there for other reasons, but then it's probably more painful because of that response.
Absolutely.
Yeah. So interesting. I feel like, there's so many examples that I'm thinking of, but I'll just keep it pretty general.
In terms of like use on the everyday, like obviously we broke it down a little bit before. What activity, like, and again, because I know it's going to be a lot, but obviously the pelvic floor is so involved in our lives. Are there staples where a lot of people see symptoms like popping up frequently? There's like staple activities like running, lifting, like anything like that. What are the kind of like typical ones that you see pop up in presentation?
Yeah, definitely high impact exercise.
Yep.
So women that are jumping, like double unders with CrossFit is a big one. Yep. Heavy lifts. Some women have no symptoms doing that. And then other women might be more symptomatic. Yeah. A lot of postnatal women that jump back into exercise, they might just jump straight back into the type of exercise they were doing in pregnancy and then might have symptoms. So it just depends. Really
depends. Yeah. And do you see it as far along the spectrum as like even just walking on day to day kind of symptoms presenting and people really being like, I'm not sure what I'm doing?
It definitely can.
Yeah.
Some women can have leaking just from standing up from a chair.
Yeah.
Like if you think of stress incontinence, essentially it's an equation, right? If you have more pressure above the bladder than pressure underneath the bladder, you're going to leak. So some people that can't generate pressure underneath the bladder, just standing up from a chair and just walking might be too much pressure above and then they could leak. So things like that, that can definitely happen. I always see it as if you think of like you have a threshold for your pelvic floor strength in your lifetime, right? And most of us are going to be sitting pretty high. When you go through pregnancy, childbirth, that might take a bit of a hit to your pelvic floor and to your threshold, but you still might be getting away with things pretty well. And then women start to go through that perimenopausal phase. They start to get hormonal changes, just general atrophy. Like as we age, our muscles get weaker, right?
Yeah.
So if we couple the general weakness with hormonal changes, that might put them right under that threshold, and then they might just potentially start leaking with really simple day-to-day activities. And these are the women that come in and they're panicked, they're freaked out, obviously. So my entire goal of treatment in even the postnatal population is to just set them up for healthy aging.
Yeah.
Just set them up for a good kind of perimenopausal phase so that they can just be on top of it.
Yeah.
And if someone is presenting that's in that perimenopausal or menopausal phase, again, it's so individualized case by case, but let's say they have had like a couple of like pregnancies and childbirths in their lifetime up until that point. If they didn't address their pelvic floor throughout those, I guess, chapters of their life, does it sort of catch up to them later on?
Yeah, definitely.
Yeah.
I often find that a lot of women don't realize they have birth injuries or damage to the pelvic floor, damage to the fascia, because they have been getting away with it pretty well. They're not really that symptomatic. They can continue to do what they want, but they might be just sitting above that threshold line that I'm speaking about.
Yeah.
And then as soon as like other factors come in, they might be symptomatic, which is why having that postnatal check is so important.
Yeah.
Even if they're not symptomatic, we want to know what we need to do to get them their pelvic floors functioning better for their lifetime.
Yeah.
It makes sense. Like childbirth, again, even if you're not symptomatic, it's no small feat. It's
Exactly.
a huge change and stress to the body.
Yeah.
Yeah.
And like even going another step further than that, how do you see the implication then of like different styles of childbirth, right? Because obviously there's natural, but then like we've got the Caesar and all that kind of stuff as well.
Yeah.
And going back to your core canister visualization, like taking the Caesar and kind of disrupting some of the tissues through the abdomen, does that change that whole concept of as well, like a lot more stress on the pelvic floor? Or do you find like that women that go through different types of pregnancies and different types of births have different symptoms or different combinations?
Yeah, they definitely have different symptoms.
Yeah.
And there's no easy way to get a baby out.
Yeah.
So they're both going to have their pros and cons.
Yeah.
I guess from a pelvic floor perspective, actually pushing and like opening and having to stretch that pelvic floor, that woman potentially might have lower tone, some weakness that we need to work on.
Yeah.
Whereas someone that has a cesarean and they're cutting through that kind of bottom of the abdomen, we might want to be working on scar tissue, abdominal separation, core strength. But also just being pregnant can have a bit of an effect on the pelvic floor. So when we're pregnant, we carry a 3+ kilo baby, the weight of the placenta, the weight of the fluid. So it's like you've got a lot of weight on the pelvic floor. So either way, the pelvic floor can be affected. It just depends how the birth goes. Really.
And again, super individual, right? Like it's never going to be like clean cut or cookie cutter approach. It's just whatever kind of presents at the time.
We had like a glass ball to see how someone's birth's going to go.
That'd be nice.
We'd be out of business. It'd be all over.
One day there's a bit more predictors available of, you know, how your birth's going to go, because it can really impact your life.
Yeah.
Oh, for sure. Even if you think it's going to go a certain way for, 9 months or whatever, and then for whatever reason it ends up shifting at the last minute, I can imagine it would be quite distressing.
Yeah.
We've kind of covered most of the misconceptions, but is there any that you often see in practice?
What are your thoughts on the whole discussion around exercise pre-birth, yay or nay? Because I feel like there's a lot of people that are like, oh, you shouldn't be exercising at all. There's a lot of people that are like, oh, you should be exercising but less than you were doing before. There's a lot of people that obviously like once this next phase of their life starts, they go, that's it. I'm like turning a corner. I just want to amp my exercise up all the way to the max.
Yeah.
Obviously, again, it's going to be a super individualized approach, but like, are there any misconceptions around that landscape?
Yeah, so the narrative is really shifted. So if you think about when my mum was pregnant with me, so 34 years ago, they were pretty much told not to exercise because it's not safe for mum and baby. Yeah. But we just know now that's so far from the truth. With the current guidelines, it's more of the fact that we want to be exercising. it has really good outcomes for both mum and baby.
Yeah.
So my passion is actually getting women to exercise in their pregnancy. If they have no contraindication, so if their healthcare team has said, yep, you're good, then go for it.
Yeah.
Exercise. If you have been training, keep doing it.
Yeah.
You're not going to go from not running at all to start running in your pregnancy. But if you've been running and you're feeling good, go for it.
Yeah.
There's no reason why you shouldn't.
Yeah, and whatever feels comfortable kind of scenario.
Yeah, exactly. There's definitely going to be things throughout the pregnancy as a woman gets bigger that we're going to have to modify in terms of the core and abdomen. But there's so much that they can do.
Yeah.
And we know strength training is so important in our life for us. Just being pregnant shouldn't mean that we stop strength training and we stop building muscle.
Yeah.
Because it's so important.
Oh, for sure. What about, I guess, the other end of the spectrum where someone might be more sedentary, but then I guess falls pregnant and wants to be, you know, as healthy as they can for that delivery?
Yeah, totally. So I would say go and see a women's health physio and then they can guide you. So start off with some really gentle Pilates and movement. There's going to be so much that you can do. Just because you haven't exercised ever doesn't mean that you can't start. It just means you're not going to start right up here.
Yeah,
You're going to start at a baseline, which is
not going to dive straight into a marathon or something.
But it's so important. It can reduce the rate of gestational diabetes. It can lower your blood pressure. Like it's so good for you.
Yeah, oh, for sure.
Kegels.
Yeah.
What
is a Kegel?
Yeah. Just let's unpack it.
So a Kegel is pretty much just a pelvic floor exercise.
Okay.
Right? So
Cool.
a Kegel is just like a bicep curl.
Nice.
Just we're using the muscle. So for some women, we want to be doing pelvic floor exercises. I like to call them pelvic floor exercises rather than Kegels.
Cool.
But it's the same thing.
Okay.
So for some women, if their pelvic floor is weak and we need to strength train it, that's going to be one way that we can do it, right? We can do their pelvic floor exercises. We can add load. We can progress it just like we would with any other skeletal muscle.
Yep.
But so for some women, it's not going to be the fix for everything. We may need to be doing other things.
Yep.
But a Kegel essentially is pelvic floor exercise.
Cool.
So just to clarify, it's not a specific exercise, but it's just a name for different exercises.
Well, it is a specific exercise. So a Kegel is, when we were saying before, like drawing in
up.
and
Nuts
up.
to, what was it? Nuts to guts?
Nuts to guts for the males.
No nuts for the females.
It's gonna be burnt into my
that
head.
and then letting go
Yes.
is a Kegel.
Gotcha.
That's a pelvic floor exercise.
Gotcha.
Right?
Okay.
And for some people, we need to be working on the endurance. So we need to be trying to get them to get to, say, 10 seconds, relax really well.
Yep.
But if you think about we're not just going to do it here and there and be able to get strong. So if you just do it every red light that you see, we're not actually taking the muscle to fatigue. And we know that that's how you actually strengthen a muscle is by taking it to fatigue so that we can grow it.
Yep.
That's where a lot of women go wrong with their pelvic floor exercises is they don't follow a program. They're not doing what's needed for them and then they don't progressively load it.
Yep. Yeah. It's sort of just doing it here and there, like a bit more ad hoc.
Yeah, exactly.
Yeah.
If you think of like that bicep curl again, like if I just did this with a 1 kilo like a few times a day,
Yeah.
I want to grow the tissue.
Yeah.
Pelvic floor is a skeletal muscle. It's no different.
Yeah.
Train it like you're doing a squat.
Exactly. If we actually want to make it grow, we need to train it.
Yeah. Just having flashbacks to my grandma always telling me because she drove quite a bit for her work and she always talked about doing, now I know that they're called Kegels, but as she was driving, she's like, I just always used to do it. And I was like a little girl just sitting there trying to do it with her. So weird. But again, you're probably not progressing, therefore maybe not getting the maximum benefits that you would expect.
Yeah, exactly.
Yeah. Is there any other misconceptions or things that you often have to like clear up, I guess, with your clients?
I would say like you don't want to be just tensing your pelvic floor all the time. So a lot of women that have pelvic floor issues, if they're going for a run or like doing high impact exercises, if you're just tensing your pelvic floor all the time, that's not good either because you're probably generating too much intra-abdominal pressure and putting more strain on the pelvic floor. You might be more likely to have that high tone if you're just tensing all the time.
Yep.
And then it might not be working effectively. So if you're, say, leaking when you're running, just tensing your pelvic floor your whole run, like you're not going to be able to do it and that's not going to be effective. So we need to train it in other aspects, not just while you're exercising and walking around. You don't want to just be squeezing.
If you have been listening along, you would have heard in our last episode that we announced a new segment, Most Effed Up Health Stories.
Yes.
So basically in each episode moving forward, Zeb and I and whoever we have on the podcast as well, so we've got today Charlotte, going to read out 2 or 3 of the submitted stories from you and choose the winner, basically. And the winner today gets a bag of Soma cacao, which is really cool. Thanks, Soma. Not an ad, but an ad. So all of these, or both of these rather, are submitted anonymously. So I'm going to read them out to you both, we'll take a bit of a vote of who takes the cake. Alrighty.
I just hope there's a farting one.
I know. Alrighty. All right, let me just pick the front runners. Here we go. Okay, this is a little bit red hot for the first one. Okay. So the first one, as I said, submitted anonymously. So got a text saying I tested positive for chlamydia, sent by mistake. I'd already told my partner, cried on the phone to my best friend, and spiral Googled, can chlamydia make you infertile? Before the clinic called and said, oops, I'm so sorry, we got the wrong person.
Oh, no.
That Yelp.
Yeah, not good. That's a strong.
happened?
I don't know. That is a strong front runner.
That is a strong first one.
Oh my goodness.
Oh, goodness gracious.
Alrighty.
What else do we get?
The next one is called the moisturizer mix-up. I need to start Googling. I was seeing a dermatologist for eczema and they asked what I'd been using. So I brought my face products to the next appointment and I pulled the tube out of my bag only to realize that I had accidentally grabbed my lubricant instead of moisturizer. Dead silence. The dermatologist basically looked at me really funny and I just laughed nervously.
Oh, God.
All right, so we've got moisturizer mix-up or STI sort of mix-up, I guess. What are we thinking?
I'm going to say moisturizer mix-up because that is sometimes a little bit overwhelming.
I would never go back. I'd move countries.
Move dermatologist.
Oh, gosh.
I'm going to vote that one too because as a pelvic floor physio, using lubricant can really help the pelvic floor.
Yeah.
Nice.
all for
On
that.
point
Good
with
on
today's
it.
episode.
It's very on topic with today. All right, well, we
They're
can't
the
say the name because obviously it's submitted anonymously, but we'll get in touch with you and give you the bag of Soma
Congrats.
cacao again. Woohoo! No, not lube. Oh my gosh. Alrighty. Pause. That is very bad. I need to stop giggling when I read
That's
them.
a good segment. I like that.
It's funny. We had a few others and then we just wanted to mix it up just to break it up.
Yeah, we were trying to think of a segment. What was the last segment that we did?
Guess the health condition.
Oh, yeah. And that got really dark.
Some of them just got a bit wild, yeah. And
We were using
Chat
AI to
GPT.
research, like, different health conditions.
But some of them were just like really morbid. We're like, oh, we don't want to read that.
We were like, we want something that's got a really complex name.
Yeah.
Cool. Okay.
We'll just do a quick ending.
Yeah, we might do quick ending and then cacao stuff.
Yep.
Nice.
Beautiful. Alrighty. Do you wanna
Cool.
start?
Well, fantastic. I've learned a lot today.
Yeah,
And
same.
especially being a male, I've learned a lot in the women's health space.
As a female who knows not much about pelvic health as well, I'm just very well informed.
Yeah, which has been
I've
fantastic.
been more well informed. I feel like I'm very illiterate today. Anyway, it's
all
Monday.
Good. It's all good. It's Monday.
It's a Monday.
But thank you so much for spending some time to block out a little spot for us in your diary. We know you have a
Very
absolute
grateful.
hectic schedule.
Yes.
And we are so excited to see the stuff that you have been putting out recently. Walk us through a little bit of your resources, just because I
Where
know
can
you
people find
do
you?
have a few resources through Flow's website as well.
Yeah, so if you go to www.flowwomen.com, we have a range of different ebooks that you can download. So we have a pelvic floor ebook, which is if you have a tight pelvic floor and you want to learn how to relax it. Then we have a pregnancy ebook and 2 postpartum ebooks.
Yeah.
So
Beautiful.
they're digital downloads that you can download. Or if you're pregnant and just nearing the end of your pregnancy, we have lots of postpartum products that can help you recover.
Beautiful.
So yeah, you can check them out.
Yeah,
Amazing.
fantastic.
And aside from that, where else can people learn a little bit more about you and, reach out if they are wanting to improve their pelvic health?
Yeah, so you can follow me on Instagram. It's Miss Pelvic Health or Flow Women.
Beautiful. We'll pop all of them in the show notes. Thank you
Absolutely.
again, Charlotte. Very grateful.
Yeah.
Thanks so much for having me. Yeah, it was pretty general, but if we wanted to dive into any of those topics in particular, we could spend a whole hour on
Oh yeah,
one of them
yeah.
alone.
Oh,
We can
absolutely.
break it down all like that, I'm sure.
Stay tuned for part 2 down the track.
Thanks for listening to this week's podcast.
Be the first to know when the next episode drops by hitting subscribe on wherever you catch your podcasts.
And don't forget to follow us on Instagram at we don't know yet.pod.
See ya.